So this is my presentation on auditory canal atresia. So what is it? Auditory canal atresia is where the external auditory ear canal doesn't develop normally during the first trimester of pregnancy. In my research, I also found that acquired atresia exists, and it occurs mostly in trauma, such as like a car accident or a gunshot wound, but it's a lot less common than developmental atresia, so we're going to focus on congenital atresia in this presentation. So atresia can occur unilaterally or bilaterally, and it often occurs with microtia or an underdeveloped pinna, and as you can see in this picture, there is both atresia and microtia. So because aural atresia has varying levels of severity, the malformation can look different. So in some cases, there's a semblance of an external auditory meatus, but it kind of will taper off into like a shallow dead end. And then in more severe forms of atresia, there can be no existing ear canal, and the ossicles in the middle ear may be absent or underdeveloped. And I have a good picture of that here in the next slide. So I really like this diagram because you can kind of see the associated microtia, the lack of an ear canal, the deformed ossicles, but it looks like the cochlea is still intact. And so in most cases of atresia, where just the outer or middle ear is affected, you see conductive hearing loss. That's one of the kind of main issues from atresia. So in the example of this diagram, it would be because you have a deformed pinna, so that's incorrectly funneling sound, a lack of an ear canal to direct the sound waves, no tympanic membrane to capture the vibrations and turn them into mechanical energy, and deformed ossicles that can't properly amplify and transfer this energy into the cochlea. And so with hearing loss, especially in young children, you can see an impact on their speech and language development as well. That's another big issue, which in turn can impact academic performance, social skills, and cause some other limitations. Another issue as a result of atresia, it's not really as detrimental, but it's something that I thought was really interesting, is that you can still get ear infections with atresia because you still have the eustachian tube. It's still intact, and so you can have an infection get into the middle ear and cause acute otosis media. But one of the dangers with atresia is that you won't feel the pressure and the pain of the tympanic membrane kind of bulging out. And so that ear infection could go unnoticed and progress into a more serious infection. I thought that was kind of interesting. As far as treatment options go, there is reconstructive surgery. So with this surgery, the doctors will first want to do a CT scan to evaluate the condition of the outer, middle, and inner ear. They'll also want to look at the facial nerve location and evaluate the dangers of potentially hitting it during surgery. Once they get a good idea of what the level of hearing is possible, they can determine whether or not surgery is something to go forward with. If the canaloplasty or repair surgery is a good option, surgeons will reconstruct an ear canal using skin grafts to line the canal and create a tympanic membrane. And middle bones can be repaired, repositioned, or replaced if needed with prosthetics. Surgeons can even reconstruct the pinna, as you can see here in this photo. Something to note with surgery is that there can be complications and even follow-up surgeries required as years go on and you grow and your body kind of changes and develops. Another treatment option is a bone conducting hearing system. This option is not to be confused with a hearing aid or cochlear implant. It is a device that sends sound vibrations directly to the inner ear via bone conduction through the skull. So there are two parts to this solution, a titanium implant and an external sound processor mic setup. So the implant is placed into the mastoid bone during an outpatient surgery. And then once that's healed, there's an external mic and sound processor that are to be worn externally. So sounds are picked up by the microphone, processed, and converted into vibrations that run into the embedded implant. And then the implant in turn will vibrate the surrounding bone, and the waves make their way to the inner ear to be processed as sound. So this bypasses, the middle and outer ear altogether. So it's a good option for someone who doesn't want an intrusive reconstructive surgery. And that is the end of my presentation on atresia. Feel free to leave a comment or ask any questions under this video.